bad pimples can be just inflammatory, or they can be very cystic, because some acne is just very large, it's painful, you know, sometimes it's very deformative, and I worry about scarring. And so I always try to jump on my patients very quickly when they have inflammatory acne, because that's what I try to prevent. So acne comes in all varieties. You can have really mild, you can have moderate, you can have severe. But the thing that I love in my bag of tricks is Accutane. And I know Accutane is one of those, oh my God, that's like the horror drug. But in my 22 years of private practice, I will tell you that I have never had anyone have an allergic reaction to Accutane. That's a lot to say about a drug. And I would say 90% of the acne that's on someone's face is totally clear at the end of 5 months. And that's a lot to say about a drug. That once I stop the drug, the acne doesn't come back. So it's an incredible tool to have. And it's not for everybody, but for a lot of people, it's a phenomenal drug. And the way the Accutane is set up, especially for women, we can't put a woman on Accutane for 6 weeks. So I usually do other things while I'm waiting to put patients on Accutane. And they have that 6 weeks in order to sort of see how their body is responding to oral antibiotics, topical antibiotics, topical Retin-A products. Some of it is hormonal driven, and I will say that, you know, especially with the women's cycle. A lot of the hormones, they affect the sebaceous glands. The sebaceous glands produce oil. What loves oil? Bacteria, and voila, you get that red inflammatory papule. Sometimes there's medications like spironolactone is an anti-androgen, and sometimes women respond to that particular medication. But it's a medication that I usually have to keep people on. It's not like a 5-month course of therapy like Accutane. Antibiotics, they're great to kill the bacteria and get the inflammation down right away. But I don't keep patients on antibiotics. In fact, I feel it's very harmful because it changes the flora in your gut. You can develop drug resistance. Long term, you can develop inflammatory bowel disease. So it's not something I take lightly. Unfortunately, I would say in the American culture, it's a knee-jerk. Antibiotics really aren't thought about in that way, but it's something to really be thought about. In fact, most of my severe allergic reactions are due to oral antibiotics. So, you know, they come with the price. There's a risk attached to them.